Has the mayor joined us this evening?
Yes, I'm here.
Oh, there you are, Barb. I didn't see your picture on my screen, so it's great to have you here. At this point, I'm going to turn the microphone over to Mayor Barb Compass to bring us greetings.
Thank
Mayor
you,
Barb.
Brian, and good evening, everyone. It's always a pleasure for me to bring greetings on behalf of the municipality of Meaford to the business community through the Meaford Chamber of Commerce. It has been a tough, unrelenting struggle over this past year and a half. While it is of little comfort to know it's the same for businesses everywhere, I want to acknowledge the leadership of President Scott Gooch, the board of directors, and your administrator, Kim Ware, as you navigate the stormy seas of economic recovery. Your ongoing partnership with the municipality on the Economic Development Recovery Task Force, led by our corporate initiatives manager, Janet Sperling, is so important to our future, and we truly value the input and collaboration that has occurred to date. When we all work together, the task seems lighter and the likelihood of success is assured, and we really appreciate your participation. And on that note of all working together, I want to pay tribute to your guest speaker tonight, Dr. Ian Arra. His leadership throughout this pandemic has been outstanding. His wise guidance and willingness to respond personally to questions and to engage all levels of government, as well as frontline workers, are truly inspiring and very much appreciated. I'm sure we'll all benefit from his remarks this evening. To bring my greetings to a close, I wish the Meaford Chamber of Commerce great success on this road to recovery and a much brighter future in the coming years. Thank you.
Thank you, Mayor Compass. It's great to have you with us this evening as well. We'll turn the meeting now over to our president, Scott Gooch.
Thanks, Brian. Okay, good. The first thing we need to do today is approve the minutes from last year's AGM. They have been posted on the chamber website, so I'm hoping that everybody has already had a chance to read them. Are there any corrections or concerns or changes required before we ask for a motion for their approval? No. Unless someone's madly typing. No, okay then. Okay then, do we have a motion to approve the minutes from the 2020 AGM?
I'll make a motion to accept the minutes as accepted and presented, sorry.
Thanks. If anybody wants to second that, just put it through the chat and, oh, there we go. Great. Seconded from Brian, I believe. We'll assume everybody's in favor unless they're opposed. If there's an opposed, please just bring it forward. No, okay, all support it then. Good, passed. The next thing is the annual reports. We'll turn it over to Joyce so she can go over the dollars and cents and let us know how things have gone over the last year. Joyce?
Actually, we've done better than I had hoped for, given the state of the economy and the way the things have gone for the last year. So the financial statements, we have a notice to the reader, a balance sheet, and the income and retained income statement. So the I don't think the notice to the reader made it to the website. So on the basis of information provided by management, Baker Tilly has compiled the balance sheet of Meaford Chamber of Commerce as at December 31, 2020, and the statement of income and retained income for the year then ended. They have not performed an audit or a review engagement in respect of these financial statements and accordingly expressed no assurance thereon. Readers are cautioned that these statements may not be appropriate for their purposes, and it's signed by Baker Tilly and our local firm here. And that's their standard notice to the reader. So the balance sheet does, which is nice because it's supposed to. And actually, the interesting part was all of our assets were larger than the year before, but then so were all of our liabilities. Revenue, membership was slightly down. The special events, of course, was way down. Recoverable expenditures were down. Miscellaneous income was up a little bit. Part of that is income that we did generate through the Apple. The student grant we had last year and we didn't have the year before. And e-commerce was a grant that we received through the municipality to help our members get set up for exactly that. And the Apple generated almost $16,000, which was mostly grants and funding to pay for the staffing. And the expenses, of course, we have the Apple, which was just over $16,000. So just about a wash, but it Kim will be able to tell you how many people that we met through our summertime activities at the Apple, and it was wonderful, much better than we had hoped for. The e-commerce, that's the costs of getting people set up on top of that. And the student awards, of course, is generated from the Dragon's Den. Insurance, bank charges, they're all slightly less than the year before. Our office expenses were down. Our payroll and benefits was down. Rent was slightly increased. Special events, of course, way down. Telephone about the same, and utilities about the same. So our operating loss was $2,640. And then we applied for the Canada Emergency Wage Subsidy and received $5,400 from that, which then for our net income for the year was $2,800, which then our retained income at the end of the year became almost $32,000. Anybody got any questions they'd like to have me expound on? I think that's, most of it's pretty self-explanatory. Hearing none, I move that the financial statements be adopted as presented.
Dan White seconded it.
Any opposed? No? We'll assume that everybody supports then. Okay, good, thank you. I think I would just like to add on that, just as an overview. With COVID, everything has become much more difficult and labor intensive. And so therefore, we had a lot more expensive in those realms. Just, you can't gather 20 people in a room, have a quick word and be done with it. And so of course, obviously the income was down. It cost more to produce dragons, but we didn't get the ticket sales and so on. So it's been extremely challenging for both Joyce and Kim in particular. And it might not be readily evident, but if you get into the finances, you can see where some of that's been a bit of a struggle. And because of their efforts, we've done well, and we're quite thankful for the $5,400 we got from the government, which did give us a boost. But it's been an extremely difficult year in terms of extra work, and you got to work 3 times as hard to get half as much done. So well done for Joyce and Kim on the finances.
Well, I'd just like to add to that, Scott. I think that everyone, listening in tonight, they need to know exactly how hard Kim had to work for all of this. And she has been incredible through all of this. And certainly very helpful for me in my position on the board, but she deserves a big round of applause and a pat in the back from every last one of us, I'll tell you.
I know, I agree.
Mhm, for sure.
Okay, Brian,
We're ready for the elections.
yeah.
Okay, I have the report from the nominating committee, and that report is that all current board of directors are standing for re-election. If there are any, and I'll list those off in a moment here. If there are any further nominations from the floor, you may submit those nominations using the chat function. Any nominations, if we receive any from the floor this evening, those names, those people will be contacted. They will receive a board member's kit application that they will fill out and submit to the board. And we will deal with any nominations at our upcoming meeting. So to move this right along, so current board of directors, President Scott Gooch is from Bayview Escarpment Fine Furniture and Cabinetry. Vice President is Rob Uhrig from Bruce Street Technologies. Past president is myself, Brian Johnson, Johnson Robertson Financial. Our treasurer is Director J.D. Moffat from the Jewel 99. Director Brandon Porter, Canadian Pet Connection. Director Julia White from the Cooperators and Insurance. Director Mitchner who is My Favorite Marketer. That's the name of his company. Director Pam Tupper from Grey Noise Entertainment. And our newest director is Angela Porter also from Canadian Pet Connection. And as mentioned, our current staff member or chamber manager is Kim Ware. She doesn't need to be voted on tonight, but we won't let her get away too easy, that's for sure. So do we have any nominations from the floor? Okay, we don't see any nominations from the floor. So can we have a motion? A motion to accept and a motion to second the nominees for election to the board of directors for 2021.
We have a motion to accept from Brandon Porter and Robert Peel as seconded.
Are there any opposed? Having none opposed, we'll declare that motion carried. We'll turn this back over to President Scott Gooch to discuss new business.
Well, thanks, Brian. Before I do that, I'm just going to make quick mention of Bob Peel, who was a member of the board of directors for longer than I've been on the board. I'm not sure how many years, and has been involved with the Chamber of Commerce, I think, for about 35 or 40 years in his life. He's stepping down now. He's just overwhelmed with other things. I just want to make sure everybody appreciates how much he has done. Bob is often the ideas guy. He lives out of town, difficult to get things done sometimes, but he certainly has interesting insight and lots of experience. And every once in a while, Bob would throw us a gem that we would run with. And in particular, Bob has been quite involved with mentoring of businesses, the selection of Dragons contestants, and in Dragon-like events at a higher level and much greater dollar values across the region. If it wasn't for Bob last year, we wouldn't have managed to get Dragons off the ground just because of his contacts. So I'd just like to thank all the work Bob has done for the Meaford Chamber in the last few years, and then with the chambers in general. And Bob has promised to help out with Dragons this upcoming year. Again, he's always run the selection committee since I've been around. He just knows what to do. And he's the father figure in many ways for the contestants. He takes them under their arm and looks after them and supports them. So if you think of that, he's a person who's been supporting businesses directly with his own time, a great investment of time, hours upon hours upon hours, drawing in all his business and chamber and community activism expertise and knowledge. So Bob, I really appreciate everything you've done for the Meaford Chamber. New business. So this is just where I kind of rhyme off where we put our focus. In the last year, and you can see the points up there, the Economic Recovery Committee, it really jumped out from, was formed from the basis of an events committee we had formed to look specifically at the Market Square and making it the center of the community and increasing activity levels in it. And it became all consuming. We had 3 members on that committee, and just a lot of time spent on that, just desperately trying to help businesses and find ways to work with the municipality and other partners to help the businesses and inform the businesses about the restrictions of COVID, how we can approach it, and how we can mitigate the impacts, and looking further down range, so at least 3 months out all the time, and further trying to anticipate what would be coming, because it takes time to maneuver the ship called the municipality. As soon as she could, marketing videos she's been having on Facebook and social media, constantly thinking and striving to find ways to put your business's names out there and remind people, don't just say buy local, but shop on Amazon, but to actually do something local. We were an early supporter of the Bumpo patios. I mean, they were working all over the world months before it got to us, and it seemed an obvious thing to do. Fortunately, this municipality had done a lot of the background work in previous years, and we were all able to all come together and get that done quickly. I'm quite happy with that. Market Square struggled a bit, but I guess we can't win them all. That we're now on the same 3 people. We're now on the events committee that stood up again, and we're looking to help any and all local community groups run and organize their special events, whether it be new events. And Rob Uhrig has one particular major event he's exploring, and I have another for Meaford, for the better economic development of Meaford, and just to shine the light on Meaford as a tourist destination in 12 months of the year. But that committee isn't looking to take over events, but rather on it we have the Rotary Club and a number of others with the municipality, lots and lots of planning experience, and just looking to marshal resources just to help out some of the small organizations with maybe a little bit less depth in some particular fields of expertise. Dragons 2020 we did last year, virtual, a great success for the contestants, not as much fun for the participants. Didn't generate revenue, cost a lot more than normal, but I think at the end of the day is to get the names out of the new businesses. We had 9 applicants, of course, of which we picked 5, and they were all quite strong. They're actually, according to Bob and then my own casual observation, they're getting stronger every year. And so that's encouraging. And they're up and running. And just a quick advert, the glamping from 2 years ago, from 2019, they're looking to actually hopefully pass the last hurdle next month, and then get up and running and start making business. Am I still working here? I just got a screen change. What are we doing here? Okay. Are we still good? Okay. Yeah. And the Apple, Kim, we managed 8,400 people, almost as many as 2019, funneled through the Apple last year. Starting primarily mid-summer, when we called it GTA refugees largely, but not entirely, were coming up, 8,400 people. It was the only point of direct delivery tourism services available. On the inside, Rob's managed to keep the internet hotspot going for tourists and for ourselves. The Apple's gone really, really well, but it's super important. And yeah, 8,400 people. I think we had 9,000 the year before. We had JD do Grey Roots Reads. Normally involves the libraries. I'm not an expert on this event, but JD actually did the Meaford contribution to the reading of the books that was on the internet site. If you haven't seen the books that were read, it's worth looking at. And we're continuing earlier, I think end of last year, but certainly or year before, we started contributing to the Meaford Independent. Every couple, 3 months, a member of the board of directors puts an article of their interest of business, anything they select, and we're putting that in the Meaford Independent. We continue to do that. It's just a way of ensuring that issues that are concerned to businesses are actually being put in front of the readers of the Meaford Independent. It's an excellent paper. It's probably the best local paper that I've seen in my travels. It's not just advertising and pets for sale or something. It's got a lot of good news. So anyhow, we're contributing to that, and we're going to continue to do that. We had a bunch of Zoom town hall meetings last year with the restaurants, but other businesses, with our MP, MPP, just early on in COVID, trying to get that communication. Communication has been the first casualty of COVID. We don't see each other, we don't talk, and as this thing drags on, we're getting further and further and deeper in our own internal cocoons and echo chambers. And so those have been useful, as they are tonight. As much as I dislike doing it through Zoom, it's better than the alternative. As a reminder, we got the community awards, and that's up till noon of April 30th. And so get your nominations in. We've got a bunch in already, but if there are businesses or individuals in the community who've done community things that you really think should be recognized, that's your tool to get it in, to get those names in, get the nominations made. And then followed on by that will be the silent auction. The silent auction, financially, we hurt last year. You may not recall, but our auction, the last 2 weeks of the auction were the first 2 weeks of lockdown last year, which meant because it was all new, nobody was spending any money. We had restaurant vouchers that went unbid for, which is unheard of. And it hurt us this year financially. It's made us struggle a bit. We managed to pull it together with a lot of work and a little bit of luck. Anyhow, so May 1st to 15th is it this year. So businesses, please freely donate items to advertise your business. And for anybody else, feel free to spend your money on these coupons and vouchers and items and things that come up. A lot of great new businesses, not just through Dragons, but other ones are starting up. Right now, as we speak, there are a number of businesses starting up in Meaford. It hasn't stopped because of COVID. And so again, if you could just pay attention, put your bids in, put your goods in, and we were very frugal with your money. Next, I'd just like to do a brief outlook for next year. I mentioned some of the things we're going to carry on. I've asked the deputy mayor, I've submitted a letter to her asking that council provide a member on the board of directors as they have done in the past. It hasn't been done for a couple of years now, and the impact is telling. There are literally no formal lines of communication between the Meaford Chamber of Commerce and municipal staff or council. And it means that it's always fighting a rearguard action where we hear something we think is bad for business. By the time we hear about it, staff's already made their cunning plan. And now we're fighting in council to try to get it undone and redone. And council and staff are worried because what they're trying to achieve is now not going to get done either because everything's too late. It's not the way things should be done. There's bad communication to no communication. And the way to address that is just we need to establish effectively liaison officers within each of the organizations. So I have done that, and we hope that's going to provide a little bit of fruit on that in the coming week. Influence paid parking, a lot of concern, a lot of chatter about paid parking policy. Again, the municipal staff paper unfortunately says it's going to facilitate and enhance economic development and community development, but they haven't actually spoken to anybody in the community or the business community, according to their own paper. So we will be addressing that. I understand the reasons why. I think most of us, if we take the time, understand why they're looking at paid parking, but I think the solution is not the ideal one and could benefit from a little more maybe teamwork on how we put that together. So on the 10th of May, I'll be speaking to council on that. And hopefully we're going to have a good way ahead on that. Zooms, we started Zoom after 5. If you haven't attended one, as much as I dislike Zooms, I gotta admit, it's good. Yeah, you can't sip any wine, at least free wine, but the after 5s are really, really good. And the format we're using based on the BNI model allows businesses to practice their elevator pitch, which is always useful. We don't do it enough. In fact, we hardly ever do it if you're me. And so I think it's very useful. And it just gets us into contact at least once a month with our peers. Apple, we're looking at getting the app put on the Ontario by Bike map. Kim's already got the application in. So all the keen cyclists are out there. The province has a map and it identifies all locations which they can find cycling information and emergency tire repairs and first aid kits and so on and so forth. And from which points from which they can be diverted to local restaurants and venues and sites. And the Apple is the obvious choice for that. I believe there's a bike shop also opening up this summer, and hopefully they're going to get on that map too. But we are doing that and seeing into that. Again, it's all about putting people through the Apple, letting people know what the businesses and community events are. And Kim, again, she's keen on hats. She's got some pretty cool Meaford hats, and she's actually sold a whole bunch. And once we get the Apple open, we'll be selling hats from the Apple and possibly some t-shirts if that goes well. Again, tourists are often coming by and saying, hey, where do we get all those local goods? And so, well, if we can make a little bit of money, we can do a little bit more work without having to get it out of membership. And lastly, I'm just gonna make the point that Dragons will be live this year. The Meaford Hall is booked. The comedian Evan Carter is booked. We got a little bit of money in the bank already. I'm gonna start working on the Dragons next. I'm excited about that. And any new businesses you hear about or know about or people thinking about it, there's great mentorship involved in the application process, business plan writing, and post-show. The Dragons are always keen. There's always a dragon that grabs up each one of the businesses because a business, a personal connection, or just likes them and takes them under the wing and then helps them make great changes to make, well, more money, which is great. Really, really great successes on that. So that's what I have for what we've done the last year. It has been really busy. And that's some of the stuff we're looking at to get this year. We want to enhance communications. We want to be able to proactively work on behalf of the businesses and the broader community, because the two go together, and obviously government, municipal government is part of that as well. So very keen, very excited, a lot to do. If you have great ideas, let us know. Thanks. That's all I have, Brian.
Okay, thank you, Scott. Now we're going to move on to the exciting part of the evening, our featured speaker. After we hear from our speaker, there will be a Q&A session. So as you're listening in, if you have questions, type them in, use the chat feature or function. The chamber, we just ask that we keep all questions, focused on COVID-19 pandemic recovery, and let's not be political. So with no further ado, I'd like Dr. Arra joined the Grey Bruce Health Unit in 2015 during post-physician consultant. As well, Dr. Arra completed postgraduate training in public health and preventive medicine and a master's in epidemiology and biostatistics. He has worked on a variety of public health initiatives, including road safety, nuclear emergency response planning, health effects of wind farms, resource prioritization, electronic documentation, implementation, climate change mitigation, and the built environment. Dr. Arra strongly believes that knowledge through research empowers both the individual and the community. So Dr. Arra, welcome to the meeting. The floor is yours.
Thank you, Mr. Chair. Through you, thank you for the remarks. Thanks to Her Worship, the Mayor, for her remarks as well. I'm quite honored. I'm going to share my screen, and I have a number of slides. Some of them could be just skimmed through quickly, just in case there are questions about them. I can go back and answer those questions. If you can give me the thumb up, if you can see the presentation, that'll be great. Thank you. So, presenter disclosure, the College of Physicians and Surgeons would require us to present any conflict of interest. I have none, no grants. The private sector does not know I exist. Public health preventative medicine as a specialty, just a general outline about the specialty, the management of the pandemic, the local epidemiology, and the vaccine rollout. So that's an outline of the chat of the talk. So it's a specialty of 5 years, similar to surgery, and it has multiple rotations, multiple areas of expertise. Some of them are related to the pandemic management, like communicable disease, senior management, which is the management of an organization of the size of the health unit, could be more or less different levels of government. Emergency management in itself, similar to, it's intuitively police and fire would respond to certain emergencies. Public health would respond to pandemics. They happen once in a blue moon, but when they do, the legislative authority is very similar to the legislative authority of other officers of the law. So there are other aspects of the training. Some of it is media and press or public communication, not talking to one patient at a time, rather the whole community as a patient in this specialty. Emergency management, definition of emergency, there are different definitions. The most useful one I find is when the resources in an area is exhausted or overwhelmed or imminently to be overwhelmed. And you can generalize it. There are complex events with our subtype of emergencies that are unique. They need to meet these criteria, or a few of them. And the pandemic, COVID pandemic, meets all of them. It crosses jurisdiction, requires a large number and amounts of resources, requires special knowledge, which is the public health preventive medicine specialty, imposes risk, threat to life and to infrastructure on a large level. So this pandemic is one of the highest caliber pandemics, the likes of which we have seen only 100 years ago, the Spanish flu that claimed 50 million people globally. So you look at this graph, it looks at the color based on the provincial framework of colors, and green is the best, yellow is after, and goes all the way to red and gray or closure. Gray Bruce is here. And you can see we were in the green and the yellow throughout most of it. We had around New Year's some blip in the orange or so. In the health units around us, even the very far north rural, last year you'd look at things, you'd think we're rural. Well, we've seen Northern Ontario getting hit really hard. So it's not the rural aspect of it. It is a complex structure of factors, variables, and I'll walk you through those as we see. This is from last May. It's easier to look at analysis that's done back in the day, so it's not exposing people's privacy, personal privacy. The number of cases that are generated from each case, case 22, infected 25, a boyfriend or a girlfriend at the time. Families are very difficult to prevent transmission through. This is an outbreak outside of Grey Bruce, and 3 of the people involved in the outbreak are residents from Grey Bruce. One of them transmitted to a few others. The rest universally did not transmit to more than one person or 2 people in a family. There isn't chain of transmission that's a real outbreak. Mapleview is the only facility, long-term facility, that hit hard early on. The care that the staff in the facility provided ensured nobody was hospitalized, let alone ended up as casualty. So how can we ensure a pandemic of this caliber in infections in different settings, including long-term care? Over 25 cases happened in long-term care. but no secondary transmission in that sensitive sector. It is not a coincidence. It could be a coincidence or good luck for one facility or two, but not 25, not over this long period of time. 2020 had 0 deaths, 21, unfortunately, 3 families lost members. These are the tools that we use in the management of emergency. IMS, some of you might know IMS, Incidents Management System. It's a system used by fire and police. It was developed by the American Army, deployed first in a civilian situation in the 1977 wildfires in California, refined down the road for the civilian world, including during SARS in Canada. We did take a good step at it to improve it as a system. We use the system on a daily basis in the health unit, especially the first 2 waves. It is taxing. The pace of the work is military, precision-wise, and staff for a long time, like it has been a year. It is quite taxing emotionally. So we abandoned it at around the second wave to move to EMS, to ECG, which is the old system, similar to it, but less robust and less hectic on staff. And we go through the same periods. There is planning, recovery, prevention, mitigation before the pandemic hit. That happened in January, February. Most people didn't even know that there was a pandemic coming. I spoke with the Board of Health in January 2020 and to the 2 counties saying we need to dust off our pandemic plan. This is coming. And that really gave us the opportunity of 2 months to prepare really well with partners. One of points, concrete example of preparation, I met February 2nd, 2020 with the chief EMS for Gray. And he mentioned beforehand, before the whole pandemic thing, that there is a need to expand the scope of practice for EMS to do more to help in treating COPD. So in that meeting, I mentioned this is the time to actually expand that scope. And one day we're going to be getting swabbing and testing. And if we're lucky, or if we're working really hard as a species and we develop a vaccine, EMS can provide the vaccine, and all these things happen. And fast forward in May 2020, the rest of EMS services in Ontario were doing swabbing based on our experience. This is the full scope of tools in emergency management. You can see down here, it's rather complex, but I'm just going to walk you through parts of it. Crisis communication and communication in general. This is key to management. Too much information is not enough when it comes to communication. And IMS is in the middle. Arra is an exercise we do on annual basis. The pandemic is novel to many people. To us, it's bread and butter. Every year we run exercises, training exercises down here with the counties, with other NGOs, with other organizations, how to prepare for a flu pandemic or other pandemics. Dealing with an outbreak in long-term care, whether it's a flu or COVID, is the same underlying principles, and we do have the expertise and the knowledge in it. This is the communication platform or model. A gentleman, a physician by the name of Peter Sandman, put together criteria for communication in public health and emergencies, and he made a career of it. And although simple, with simple colors, we do this on a daily basis. Where the public is, based on the information that we receive, whether it's from partners, from police, from compliance data, from surveys, or most credibly is the leaders of the community. Local municipal leaders have been instrumental in the management of the pandemic, because they know their municipality, they know the anxiety when it exists, they can characterize it and communicate it, and we do communicate back, and we build that trust. So this is an example of the stakeholders we communicate to whenever we find one case in a school, and especially early on when the first cases happened, there's a lot of anxiety. The Board of Health, the public, school officials, the warden, the mayors, CEOs of the area, it's much reassuring to the public when they come to the local political leaders, to the mayor, and say, we heard there is a case, there's an outbreak in school, and if the leader has already the knowledge that public health is already dealing with it and the size of it and the scope of the response, it will be very reassuring to the public. And it's a cycle that feeds into itself, where we build more trust in the public, to the leader, to trust in the health unit. There is the happy medium where the public will function the most to respond and deliver. You look at last week, it was crisis communication. We had 70 cases in one day. And how to move the public back to the middle, that, this is large, huge. However, we can manage it. It is manageable. We need you to do this and this and this, and we are doing this and that. And universally, the public has been responsive. Precautionary advocacy, can take an example not related to the pandemic, rather lead in water. Many people didn't really pay attention to it back in the day. It is very dangerous hazard, but it's not causing any anxiety. So we need to increase the concern of the public, bring them to the medium. Wind turbine is another example where there is an outrage, but there is nobody dying of wind turbines. Unless a wind turbine falls onto somebody, it's not going to really hurt them to a degree that they're going to go to a hospital. There are certain cases where there is a severe effect, but it is in general outrage management. To put it in perspective, bring it back. We do this on a daily basis on multiple fronts, and we need to increase the concern of the public or reassure them. And hopefully we don't get crisis communication much. Last week was probably one of the very few occasions, junctures, where the crisis communication was needed. Data, we do use data on a daily basis. Trying to open this, sorry, it's on the other graph. I have 3 screens, sometimes they don't talk to each other. I'll open it here and move it over. This is one of the reports that we use on a daily basis. It's internal, where cases are absenteeism in childcare, school absenteeism based on age, number of childcare centers that is at a different level of risk, visits to the ER for mental health, restrictions causes that health concerns, and other data. This is a graph from 100 years ago from the Spanish flu. The two bugs, the two pathogens, COVID and the Spanish flu, are different families, but they have similar characteristics of transmission, are not of 2 to 3, which is technically how many people a person can infect if they're infected. And you can see there is a wave in the spring, a wave in the fall, bigger, and a wave in the spring again. And if you asked me a few months ago, I would say I will never get to this third wave because we had the vaccine and we have the capacity. Obviously, the supply to Ontario is modest, did not allow us to do this. I do believe we're over the hump for this third wave in Grey Bruce. The numbers in the province are still hovering high, and that happened in December and November. The numbers were late November, early December. Numbers in the province were going up. In Grey Bruce, they were going down. And I do believe we have full confidence in the response locally. And I will walk you through this response pillars. Those are the 5 pillars that really make difference in Grey Bruce comparing to other areas. And it's not a coincidence, all of them work perfectly together. We have public health that's engaged. We have the public informed, engaged, concerned, but not afraid. Each term has a unique definition and it's measurable, and we ensure it is there. The trust of the public is paramount. Public health has robust protocols. They predated me. I can't take credit for them, but I do have not only competency, but mastery in utilizing them. And the team here is burning the candle at both ends. Communication, as I mentioned, is key. Local political commitment to health. This is a term that you can study, measure, and in Grey Bruce crystallized nicely. Municipal and MPPs. Journalism, media in Grey Bruce did a bang up job. There is only one story. Any day of the week outside of a pandemic or in big city media, you would hear the story and the other story. There is 2 sides to the story. There isn't. In COVID, there is one. It's a disease that can kill and that we need to be very careful with, and there are certain measures we can implement for the public to protect themselves, protect their families and the community, and journalism delivered. Community partners, NGOs, private sector, Bruce Power, Chapman's, just two examples around the table in your chamber. There are many people who contributed, whether in closing whenever we need to close or opening as fast as we can. And you might be pleasantly surprised when you look at the principles of the management in the coming slides. Healthcare system, our hospitals had less than handful of cases. So they have been our insurance policy, and we need them. Long-term care, people did amazing work. The hospital system did the testing, did many things. Luckily, we'll never, or hopefully we'll never use that insurance policy like auto or home. You buy it, you beef it up, you hope you will never use it. Primary goals. Many people know the first goal, reduce mortality from COVID and disease. Most people forget that this is as important. Disease mortality from measures against COVID. Walking the line, opening as fast as we can, so long it is safe. This is the principle of management of a pandemic. People take it from, it's a paradigm shift if you want to understand it. Most people point the finger to public health, saying like, you're locking it down. You want to lock it down? No, absolutely not. My goal is to open as fast as we can. And you've seen through the pandemic, Grey Bruce, if we have the option to close, we close last and we open first. And legislatively, if the province restricted, the local MOH does not have authority to override it and open. We have the authority to restrict more, but we universally throughout the pandemic, we haven't had to go more restrictions through the province. Last week was one request, it wasn't an order, and the public delivered. And measures against COVID can cause death and disease for many things. Mental health, domestic violence are intuitive. Cold-related injury and heat in the summer. Last summer, we were lucky not to have a hot summer. The less affluent of us, people who don't have air-conditioned environment, would have to struggle and suffer. And there could be death resulting of heat. Cooling centers are tricky if you're going to ensure social distancing. The first item is the most important one, and it's really related to the work this chamber does. If you Google public health agencies, social determinant of health, top that list. There's a list between 10 to 13, depending on the agency. Public Health Agency of Canada has 13 items. Top that list is economic income as a determinant of health. How much income there is in a community or a person or a family determines their health. And we really need to see through the emergency, the 1 year or the 2 years we're going to be dealing with. In SARS in Toronto, the tourism industry took a hit that they didn't recover from for 8 complete years. And it was so easy if public health goal is to shut it down, to say we're closing everything. But that means we're going to affect industry, local businesses, small business. We're going to affect tourism, one of the drivers of the income in the area. And that was throughout the emergency, especially last spring, there was so much anxiety about the visitors and the tourism and all these things. And you assure the public, we got it. Public health got it. And we don't need to close anything. And, the summer went by, there was not a single reported case from a visitor. And I do believe we walked that line where ensured safety, but also income for tourism. And for years to come, people would not be traumatized. It takes one negative incident to destroy the tourism industry for years. Some of the data sources we have, vaccine surveys and other surveys, trust in the Grey Bruce Health Unit Management. Busy graph, if you look at the red, those are the people who don't trust, usually anti-maskers, anti-vaxxers. There aren't many of them. They have a keyboard and they get loud online, but in real life, most people strongly agree in the blue, and some won't agree. So if you get 60% of the public doing something, you would get good public health response. In Grey Bruce, we have 80 or 90% for most interventions, and Here's a list of them, whether it's hand washing or taking care of distance, physical distancing, wearing a mask. Most of these indicators have read less than 5%, usually 4 or 3. Similarly, travel and staying at home whenever people are asked, most people would do the right thing. Vaccine model delivery. These are, this is titled wrong. This is the epidemiology, in the area. Sorry, I apologize. This slide was put together today and I left that title. So epidemiology in the area, we have over 1,000 cases, which is a modest number comparing to a population similar to our population. Around 100 active cases today, 300 high-risk contacts. 4 days ago, this was 600 from last week's surge, and we wrestled it to the ground nicely. There are 4 confirmed hospitalization in Grey Bruce, 3 deaths. There are a couple deaths related to residents from here. Their address is here, but they lived somewhere else. They got infected somewhere else. They end up in a hospital and succumbed to COVID somewhere else. Outbreaks in long-term care, 0. Retirement homes, 0. Schools, 0 at this point. Childcare, there's 1 closing very soon, tomorrow or the day after. Like, this is as good as it gets in a pandemic after a year, knowing that all the fatigue and the variant are in the equation. Vaccines, that's the second part of the talk, and I'm gonna go through it a bit faster, just in the interest of time, but I'll be more than happy to go back for questions. It's related to the trust in the health unit, related to the trust in the recommendations, and you can see anti-vaxxers are less than 4%. Most people want the vaccine. If you get 70%, that's herd immunity. We already have it, and this is from January, this survey. It only goes up when people realize that, others took the vaccine and nobody grew a 3rd ear. And the likelihood of getting the vaccine, again, similar stats indicating most people want the vaccine. 6 out of 10 want it in January. And this is reasons for getting the vaccine: protect oneself, family, friend. It goes down for different reasons. Reasons for not getting the vaccine. Vaccine hesitancy is a very complex subject, and it's individualized. Each person is a unique event. Sometimes you get the email saying, do you know that if you address the religious factor, you can get this many people? I think we know, but we know it's way more complex than that. Within a group of people, there are different reasons. Within the individual, there are different reasons from time to time. So vaccine model delivery, this is the right title. We have 5 in Grey Bruce, the hubs, 3 of them, mini hubs in different municipalities that are not close to the hub, pharmacy and primary care, and we support both in cold chain and registration for the vaccine. Indigenous community, both indigenous community reach herd immunity with first dose. Mobile teams, we have mobile teams working with the EMS and volunteers from the community. We have over 460 volunteers the last time I looked at it. And we can deliver the vaccine to Amish, Mennonite, long-term care facilities, to individuals in their home, if they're homebound, if the need be. The main barrier for vaccinating the whole population within days is the amount of vaccine Ontario is receiving. And we're getting our fair share, 55,000 vaccines so far. That's 33%. That's a bit above average rate of delivering the vaccine. We have 2 booking systems, the one provincially based on age. We had our own system mapped out how to deploy since January, but we piloted the provincial system here. And when we realized the provincial system really works for age, does not work for other variables, we deployed the other one to complement it. I would ask you or invite you to visit our dashboard. We put this data on a daily basis on vaccine delivery. Every day there is more information on it. And we have another one for cases as well. Innovation, mass immunization system designed by myself, developed by the collaboration of everybody in Grey Bruce, my team, the municipalities, the county, Bruce Power, Chapman's provided the freezer, 2 freezers, and Bruce Power provided another freezer. It has been replicated in different parts of the province: Sudbury, Lambton, Manitoba, Alberta, and it's probably worth playing a video, 1 minute or 2-minute video after the slides. Yes, this is the time for it, if I may. That will walk you through the hub. It's video communication that we put through so the public would know exactly what they would experience through a fly-through or walk through, a combination of it. I wonder if you can hear the music though.
As the COVID-19 vaccine becomes available in a steady supply, mass immunization hubs will be set up in Grey and Bruce counties to administer thousands of doses throughout the spring and summer. When you've received notice from the government that you are eligible, you can book your appointment. Here is what to expect. 2 methods will soon be available to book your appointments: the online provincial booking portal or the telephone hotline. Once available, you will be able to access them directly from the Grey Bruce Health Unit website, the COVID-19 vaccine app, or the provincial vaccine website. Bring your mask and health card and arrive on time, not too early nor too late. If you come by car, parking lot signage and on-site attendants will direct you where to park. Follow the signs to the vaccination center entrance and put on your mask before you enter the building. Inside, a staff member will greet you and ask you a number of standard screening questions. You'll proceed to the registration area where you will give your name, health card number, and contact information. Then you will be directed to a waiting area where you can expect a few minutes wait while the vaccine bay is clean. A staff member will guide you to the appropriate vaccine bay, where you will be instructed to place your belongings under the chair, pull up your sleeve, and await the nurse. After confirming your consent, the vaccine team will administer your dose and discuss aftercare with you. You will wait for 15 minutes to make sure that you're feeling well. An aftercare nurse will be available if you have any concerns. The vaccine times are posted on the wall to indicate when to expect the aftercare nurse, who will let you know when you can depart from the center. Follow the arrows to the exit, and please do not stop to talk with anyone. If you require a receipt, you can stop at the receipt station on your way to the exit or request that it will be emailed to you. Understanding and respecting these procedures will make sure that the vaccines are administered promptly and efficiently.
And that brings us to the question period.
Excellent. Well, first off, thank you very much, Dr. Arra. That's an excellent presentation. And on behalf of the Chamber, I want to just thank you for the work you do. So we do have a few questions for you. Yes. You alluded a couple of times to your team, and I'm curious, as much as we see you a great deal, I'm sure you have you're like the proverbial duck that underneath there's an awful lot of activity. So I'm just wondering, how large is your team? How many people do you have actually working with you on this project, on these projects?
Sorry, I missed just part of the question. How many? Or
yeah.
So our team is around 100 in daily or on normal years. We recruited temporary employees around 60 over the pandemic just to scale up for response. For example, for the school response, we needed 12 more nurses for schools. So we start hiring early in the spring to have that number ready. So currently 160, but that includes 50% increased over the pandemic.
Did you get enough?
Well, and an excellent job, we might add. Yeah, we have a couple of questions specifically, and again, bearing in mind you do not have a crystal ball, and I'm sure everybody wants, great answers, but it's all so subjective. But one of the major topics, obviously, is in-school learning versus at home, and any concept at all what you feel that when we would realistically think we could go back to in-school learning?
So based on numbers, we can go back right now. The thing is, with the provincial direction, as I mentioned before, 10 minutes ago, the local MOH does not have authority to override restriction from the province. We have the authority to restrict more. So in this case, the schools would remain closed until the province goes back to that level to open schools. There is a potential of regional approach where they will say areas that can be in the green or the yellow can go and open. And today we are in that level. We had 5 cases today. I suspect tomorrow it's going to be less. We might see an slight increase next week or none, just because people who were infected last week in the surge will infect other people who will stay dormant until they convert to cases, but they will convert to cases in isolation since we trace them. All in all, we are in a good position to open schools next week. Nevertheless, the provincial direction would not allow us to.
Yeah, it's truly a shame that these kind of things become political footballs, not necessarily municipal level, but definitely more provincial and federal, that it becomes such a great talking point. Do the health units independently have much sway or say with the provincial government in terms of activities or actions?
We do. We meet with the provincial team, the chief medical officer of health team, and other teams on weekly basis. We meet 2 or 3 times. Whenever there is a decision about moving from color to another, the chief medical officer of health would reach out to the local MOHs. The province would look at the data from the past 2 to 3 weeks. So the week from 2 weeks ago, before 2 weeks ago, and they will contrast this with the local situation on the ground, which would come from the medical officer of health, the local one. So we make these decisions in combination of data, local and provincial. I do believe it, and that's, I am very objective in the way I say it. As a medical officer of health, the position is non-partisan. I don't belong to any party, and as a person, I am a partisan, non-partisan. It is a privilege to operate in the system we're in. I have colleagues across the province, the country, who would see that public health has not been given the resources they need. The way we delivered in Grey Bruce would have not done without the resources that Chief Medical Officer of Health and the Ministry of Health and the province in general has provided.
Okay. A couple more questions here. Specifically, why do you feel the spike on 21st of April? Was it related to dose availability, lack thereof? What factors came into play?
As always in public health, it's multifactorial. The main factors I would see, and I study them on a daily basis. They're very clear. Like to most people, it's a speculation. To us, it is as solid as touching this desk in front of me. Fatigue, COVID fatigue is cumulative. The fatigue that happened over the past year would affect any person, no matter how committed they are. And that's one. The variant is another variable in the equation. Both events that happened 10 days ago are related to the variant and the high infectivity of it. The efficiency in transmission of the virus was key. We usually see a person infecting their family, immediate family, 1 or 2. Sometimes not the entire family is infected. With the variant, everybody that's close to a person is infected already and infecting somebody else before we get to them. It's just the period of window of time of incubation is short. So these are the 2 main reasons I would say in the surge that happened.
Thank you. Couple of questions related to specifics. One says, we have heard that pregnant women are at high risk. Are they currently able to book themselves into a vaccine clinic?
Pregnant women are high risk. With the variant, there is an added risk. We have seen and heard about younger people ending on ventilators, and that's why we advocated to the province. And to my delight, the response was immediate that we can provide the vaccine to pregnant women. In Grey Bruce, there are around 1,300, 1,400 pregnancies or deliveries per year. And we mapped out what's the best delivery model. And it's very similar to chemotherapy patients. We have a clinic on Thursday every week that if people show up, booked in it through our website and show up, would just provide attestation that they're receiving chemotherapy or they're pregnant, and they will be offered the vaccine.
Great, thank you. Is it possible that the clotting could be caused by intravascular injection versus intramuscular? And it says, do all administrators aspirate before injection?
That's a good question. I don't know if I am the expert in it. My understanding from NACI statements, NACI is the National Advisory of Immunization for Canada. It's very similar to the FDA, the equivalent to the FDA in the United States. They approve vaccines and license use in Canada. And AstraZeneca remains licensed, and there was a precautionary application to it to say anybody's under 55 should not use it until we verify it. We saw this age limit went down to under 40, and that's based on the fact that there are reports coming out of Europe where there are clotting happening, and the mechanism of the clotting is a specialty on its own. I don't claim I'm the expert in it, but it is not related to other clotting factors, rather just on its own an entity. Worth mentioning that COVID itself causes clotting and causes death related to clotting. And the chances of getting COVID during a pandemic and getting clotting are way higher than getting clotting from the vaccine. The chances from the vaccine is around 1 in 200,000 or 4 in a million, 250. And that's to get the clotting. So it is still a safe vaccine by all measures. Allergy to peanuts can cause that severe reaction that can put the person in a hospital. So all in all, it is a safe vaccine. That's the message I would put there. The mechanism of effect is not something I can comment on.
When it comes to clotting, it's interesting because, and again, unfortunately, what you said, public representation or the press, frightening figures tend to sell a little better. I'm wondering why they don't. A couple of things they don't post as much as active cases are cleared cases, which would go a long way to say how much success we've had in that. And also with clotting as a whole, I've seen, and again, I hope statistically it's correct, but there are comparisons. For example, as you said, it's like 1 in 200,000 for a case clotting potentially with COVID versus something like birth control. I thought it was something like 1 in 1,000 or something I read in women. So again, to use those as perspective to try and mitigate the fear would seem to be a better use of press than fear about, large numbers of infections, etc.
Those are all good points. Sometimes when things are in the media, they're conveyed in a certain way. I would encourage people to spend 15 minutes a day for a few days and go to NACI or the Public Health Agency of Canada, Health Canada. When a person is informed, it takes a couple hours of reading about vaccine. They can make a good decision. Watching the media, fear can happen unrealistically for many reasons. And the examples you used are very, very appropriate in putting things in perspective.
Again, just sort of staying with the clotting a little bit, someone just asked, which vaccine is safest for someone with a weakened immune system? And what about a person with a previous blood clot?
So the 3 vaccines we have right now seem to have very good efficacy, all of them. Pfizer and Moderna had efficacy of 95%. And probably I should introduce the definition. Efficacy is the impact of the substance or the vaccine in a clinical trial. It's called efficacy. Effectiveness, on the other hand, results from the data collected from the general public when you use it on a wide scale. And effectiveness is more robust than efficacy. Efficacy is based on the number of people in the clinical trial, effectiveness in the general wide public. So when AstraZeneca first came out from the clinical trial, it was around 75 efficacy. The effectiveness data from AstraZeneca is as good as Pfizer and Moderna. My understanding, the data that came from the UK a month ago is very reassuring. So again, you put all these vaccines, they are effective, they are safe. I would say the good vaccine is the vaccine that's offered at the time, and I would not hesitate to take it myself or prescribe it to my family when our turn comes.
And the same goes for Johnson & Johnson?
I haven't seen the NACI recommendations on Johnson & Johnson, but my understanding it is similar. Johnson & Johnson is unique in a way it's one dose. So it really is useful in certain populations and public health. It's like bread and butter. Mental health, people who use shelters, foreign workers arriving in an airport. It's one interaction. You give them the vaccine, you ensured the immunity is there. It's very difficult to ask a mentally not well patients to come back after a certain period of time on time to get the vaccine, or to try to find somebody who's homeless to give them the second dose. So that's probably the most useful application for that specific vaccine. Back to your question, I haven't seen the NACI recommendation on it.
Thank you. Charlie, I see, has raised his hand. He has a question, presuming he can't get it in chat. So, Charlie?
Can I speak? That's okay.
Sure.
Yeah, I was just wondering more towards maybe what small businesses and the younger people can look to this summer as in towards farmers markets, craft shows reopening. Grey Bruce is in a better position. I'm just wondering maybe what we can expect over this summer. That's all.
Well, through you, Mr. Chair, it is difficult to predict far in the future. In general, I'm going to tackle it from 2 points. Anytime we're looking at data, solid data is 2 weeks in the future or 3. And based on the fact that the virus incubation period is two weeks. So when we find the case today, that infection actually happened 2 weeks ago. So I would feel very comfortable predicting for 2-3 weeks. Anything beyond that is modeling, and modeling is based on assumptions. It's a science, but it is based on assumptions, rightly so. So that's from one point of view, and the answer, I joke about it sometimes, saying that if I know the answer, what's going to happen in July, I should buy a ticket, go to Stockholm, pick up my Nobel Prize, because nobody knows what's going to happen then. Having said all that, I'll finish it with a different angle. These viruses have seasonality to them. We know that the flu every year will start around October, November, peak around January, and go down in 2 months. And regardless of the strain of the flu, it's going to take that same shape. And similarly with COVID, from that graph from 100 years ago, you can see 3 waves. So it's going to be similar to that Spanish flu from 100 years ago. So we know that last year, the peak was in mid-April. By end of April, for Grey Bruce, we were at a baseline that's manageable. We stayed like this most of the summer. And during parts of the summer, we had no cases for 5 days at a time. I suspect we're going to have the same trajectory this summer. The variant is a different part of the equation. It's a wild card there. You know, if we get this variant that's circulating in India, is it going to change much? Again, my own bias is not. We're going to be stable during the summer, and we're going to end it through the vaccine before the end of the summer. But again, there's always that aspect of prediction there.
Thank you. Another question had from one of our viewers. We received our first shot through our family doctor. Do we need to go through the same channels to book our second shot?
No, there is no need to be in the same channel if there is a booking system in one of the hubs or the clinics or a pharmacy, so long it's the same vaccine. A person who started with Moderna, they should have the second dose of Moderna, Pfizer with Pfizer, and AstraZeneca is the same, but there's no need to book in the same location. It will be convenient since they already have that experience there.
Okay, I don't want to really, we don't have too many more questions. I don't want to really burden you longer. Thank you very much for your time. I just had one more question, and it related to, as Scott alluded to earlier, because people can't travel out of country, we've had a nice surge of people visiting us last summer. And we presume it's going to be similar again this summer, just because as people cannot travel abroad, they tend to take in their own country and province, etc. Statistically, is there any analysis on, there's a lot of fear that talks about the people that come from the Horseshoe, GTA, etc. We have up here a large cottage base. We have large second homes, large farm, chalet communities that people come here a lot, both winter for ski season, summer for boating recreation. Statistically, is there anything to point to fear with tourism, travel, et cetera, beyond the normal stay-at-home situations?
That's an excellent question. And universally, in every reported case we had, it indicates that tourism is not an issue for transmission. There hasn't been a report of a case of a visitor who came here to visit as a tourist. The cases universally in Grey Bruce have been transmitted through family and friend gathering. So if somebody's coming from other health units to visit their family and they're spending time to attend to a party, that is risk. But a tourist coming to visit the trails or the attractions, there has not been any report. And during the past summer, there was not even a report of a person infected here going back to their health unit as a visitor. And there was contact tracing in both health units. So we would know if somebody, let's say there was a beach in gathering and a group of people were infected went back to their health unit, we would have known about that, and that didn't happen. And if I can circle back to just to clarify the totally different question, the Johnson & Johnson, I did not read the statement from NACI because it has not been issued yet. I should have qualified that. Not sure if I answered the question about tourism and visitors.
No, that was great. Thank you. The last question I think I have is just relating to, and again, no crystal ball, but vaccines to local pharmacies. Again, we're waiting provincially and on a country level, federal level, for all the vaccines to arrive. And now they're talking about, trying to mitigate by hitting hotspots, which there seems to be some good logic for that. But how does that affect what potential quantities of vaccines Grey Bruce might see?
Well, it's one of the strategies that are known to vaccinate in hotspots, especially if there are outbreaks that are not controlled for a long time. And there has already been evidence of effectiveness in those areas to reduce mortality. Is it going to affect us in Grey Bruce in lowering the amount of vaccine we're receiving? Perhaps if the amounts are modest for Ontario in general. If we see increase in the shipments to Ontario, it really wouldn't matter. We do have the capacity to scale up. We have the capacity effortlessly to vaccinate 25,000 people per week. And if the need be, we can run the 3 hubs every day, and it will be 10,000 per day. Again, I wouldn't focus much if the vaccine is going to hotspots or not. At the end of the day, patients who are getting on a ventilator or an ICU in a hotspot are being transferred to our hospitals. So protecting people there is going to protect our capacity in the hospital here. We're all in this together. Right? You say it, you hear it every day, but it has many, many aspects to it that is true. And we all need to be patient and just wait for this vaccine when it arrives, when our turn arrives. It's worth mentioning, I qualify for the vaccine as a healthcare provider, and I attend to the vaccine clinics periodically. I made the decision to wait for the vaccine, and I will enjoy getting the vaccine when everybody who has higher risk than me based on age and medical condition receive their vaccine first. So again, we all can do a bit more to ensure the least advantaged of us get the vaccine, and we will get our turn.
Great, thank you. There was one more question came through that actually is very relevant to our region again. So when the migrant workers arrive, will they quarantine for 2 weeks and or be vaccinated?
Both. The current policy, and all MOHs really supported it, is to vaccinate all workers when they arrive in the airport. So that will make it much easier instead of sending clinics to farms, and they need to isolate for 14 days.
Great. Well, thank you again. I'm sure you've answered these questions 100 times, and we appreciate you taking the time to answer them for our group. And I'm going to turn it back over to Scott so he can wrap up the meeting for this evening. Thank you.
Thanks, Rob, and thank you, Dr. Arra. As Rob, it was a great job in the moderation. It was nice to get some granularity, and I read the BBC News, the CBC News, and other news every day, but sometimes there seems to be an agenda or a little bit of ambulance chasing with the articles. So it was nice to get the granularity. Maybe it's because of my background in disaster response, and as a research scientist, I like the detail on the slides. It wasn't, I could have probably spent more time looking at those, but probably that's just me. So yeah, we really appreciate it. I found it quite useful. Found the information quite useful. I found some of those excellent our questions were excellent in that they apply to specifically to our area. So again, I really appreciate the time you spent with us tonight, Dr. Arra, and I thank you. And
Thank you for having me. I really appreciate the opportunity, and thank you so much for all that you do. You're modeling the way for the rest of the community. Take care.
Thank you. So the last business we have is adjournment. It is now, according to my clock, I think it's 27 after the hour. But if we could have a motion to adjourn, that might be useful. Oh, Dan?
Dan White?
Do we have a second on that?
I'll second that.
Okay. Or Sonia as well. I think unless somebody objects, we're going to assume before all the icons disappear that everybody is in support. I appreciate everybody who came out tonight. I appreciate your support and your attendance. It was great. Thank you.
Thank you, everyone.
Thanks, Sonia.